Hi guys, this is Amy with the Mother's Prayer. I was just giving you guys a little bit of an update. I know it's been a while since I've posted. Me and my husband took 2 months off of fertility treatments just because life got so busy with work and everything. And I got some more information for you guys just to keep you guys up to date. If you guys don't know, I have polycystic ovary system, which is PCOS, and there are a lot of ladies out there that have it, and it's kind of relatable to endometriosis. So what it is where you get cysts on your ovaries and your eggs don't release, they just harden and turn into cysts. So there's a lot of medicines out there that the doctor will prescribe you. So I will kind of go over that. I have tried Clomid for a little while. I've been on Clomid for about 2 years, off and on, because you can't go consistently 2 years on Clomid because it does have a lot of side effects, and it can cause long-term effects on your body. So you want to make sure you always look into the medication that you are taking. And I have done some research for all of us. The Clomid for us, it hasn't worked. The first time it worked was I would say about after 6 rounds of it, it started working, and then we miscarried, and then after we miscarried, it stopped working for us. I was producing my eggs, but I wasn't releasing them. But I mean, for Clomid to work, you have to be able to produce eggs and release them. So if you're having a ovulation problem with not being able to release your eggs, there are other medicines out there for you. I was going over some YouTube videos, and they were telling me, it's called the Fertility channel if you guys want to look that up. He was going over Clomid and Letrozole is what I'm on right now, is Letrozole. And that is recommended more for polycystic ovaries and those who have tried Clomid for a while and it hasn't worked. So this is probably the medicine that your doctor will prescribe secondary versus the first medicine that he'll prescribe you. Now, let's see. I was going to go over some of the benefits of Letrozole versus Clomid, because you get into different medicines and you want to research your medicines before your doctors give them to you, so you know what you're putting into your body and the effects that it will have on your body possibly, because then you don't want to take the medicine and be like, oh wow, I feel weird, you know. You will have a fair warning of what you are intaking and the effects that it will have on your body. If you are just beginning your fertility journey, you will probably be on Clomid for a while. And Clomid, when I took it, all it made me was a little moody and drowsy. I got headaches with it, pretty bad headaches when it was working, and a little bit of ovary pain whenever I started ovulating. Clomid wasn't that bad. But then again, it wasn't working all the way for me, so I don't think I had too many effects from it. Whenever they upped my dosage to 100 milligrams for 5 days, that's when it started giving me the worst symptoms, which all I got was a little bit nauseous, headaches, and mood swings. I had pretty bad mood swings and hot flashes. I had really bad hot flashes with Clomid. Now, Clomid has an anti-estrogen effect on your body. So if you are already low on estrogen, this is not a good drug for you. And I did not know that, because my uterine lining is normally pretty thin. So whenever I go into the fertility specialist, he usually tells me that my uterine lining is not looking as thick as it needs to be. And he usually gives me an estrogen pill to take for a couple days, and then I wait till my cycle comes, because it's not healthy to produce a baby on a thin uterine lining, and sometimes Clomid can actually cause a thin uterine lining. So if you do conceive and you start getting faint positives and then they go away, that's when you know you probably had a chemical pregnancy. because your uterine lining probably was either too thin, or you implanted in a wrong area. So Clomid is anti-estrogen. So if you don't have a whole lot of estrogen in your body, Clomid is probably not the best option for you. And if you know that you don't have a lot of estrogen, or you have a hormone imbalance, let your doctor know. So he does his research and has all the information collected on you to do so, to give you the right medication for your body, and kind of tell him your symptoms. Always be as open with your infertility specialist or your gynecologist as much as you possibly can, and tell them, hey, I'm having hot flashes, you know, I feel like I'm premenopausal, or whatever you are feeling, or if you have a history of endometriosis or polycystic ovaries in your family. Letrozole. Now, letrozole is a breast cancer medicine. So these doctors were putting these breast cancer patients on this letrozole, and it was curing their cancer. It was taking it away, but then they realized their patients were getting pregnant after that, and then they were like, oh wow, this could be used for fertility medicine. So it hasn't been as around as much as Clomid has been. Clomid has been around a little bit longer, so that's why they recommend Clomid first, because if Clomid works for you, then that's awesome. But if it doesn't, and you have polycystic ovaries, or if you have endometriosis, your secondary medicine would be letrozole. Now, letrozole, it does not work the way Clomid works. Clomid, what it does is it blocks your hypothalamus. It blocks your receptors for estrogen, so your body goes into low estrogen mode. Now, in some people, that'll kick in your body to think that you need to overproduce estrogen, which will enhance the thickness of your uterine lining, and it will also help you create more eggs. Now, in other people, it has a reverse effect. It will thin their uterine lining, and they won't produce enough estrogen. And also, Clomid can stay in your body for about I think 5 or 6 weeks, I believe. I think I wrote it down somewhere. Well, it stays in your body for a significant amount of time. So if you did get pregnant with Clomid, the chances of you having a birth defect is higher if you are on Clomid, because if you conceive, that Clomid is still in your body, and it could affect the fetus that you conceive. So there are birth defects, a higher birth defect rate with Clomid versus letrozole. Because letrozole, by the time your egg is into your tubes and ready to meet with the sperm, letrozole is out of your body by then, which is great because that lowers the rate of birth defects, and that's what you mainly want, especially if you are taking medicine like this and you're scared of birth defects. I would definitely go with letrozole over Clomid if you've been on Clomid for a while, because Clomid starts to hurt your body more than it does good. Okay, so what the letrozole does is it takes the testosterone in your body and turn it into estradiol, and then it turns your androgens into estron, something like that. I'm not a doctor, so I don't know. But all I know is that if you have a lot of testosterone in your body, it will turn that testosterone into an estrogen form. So it doesn't block your hypothalamus or anything like that, and it doesn't affect your brain as much as Clomid does. Now let's go back to the birth defects of Clomid versus letrozole. Letrozole, the birth defects is 2.4%. There's always going to be a risk when you're using a chemical to get pregnant. Now Clomid is 4.8%, because it forms a blockade for estrogen, and it's in your body for a longer amount of time, 5 to 6 weeks. That's a long time. Because if you think about it, you only take it for about 5 days, and then, you know, within that 5 days you're ovulating, and you're sending that egg down your tube. And the Clomid, if you take it on the wrong day, it can actually cause a miscarriage versus help you get pregnant. And Letrozole is already out of your body, and you're going to have a healthy pregnancy, a more likely healthy pregnancy than you would with Clomid. So it's always good to do your research on your medicines that you take. And I know some people are just now starting, and those who are on their journey, and they've been on their journey, I'm sure that they have already looked into the difference between these two medicines. So Clomid can stay in your system for 5.5 to 6 weeks. So always remember that. So Letrozole seems like it is a lot safer. And the chances of twins, I know there's stories about Clomid twins versus Letrozole twins. Now Letrozole, it has 0.9% chance of twins. Now if you already have problems conceiving and have problems with your uterine lining or anything like that, having twins is, you're going to be high risk from the start. They might not make it within your pregnancy. You might miscarry. Your miscarriage is higher. Your miscarriage rate would be higher versus having a single baby. Now with Clomid, now Letrozole was 0.9. Clomid is 7 to 8% higher for the conceiving rate. That's a lot higher than Letrozole. Now, there's a lot of women out there that are like, oh yeah, I hope I have twins. You know, and I hope you do. I hope you have no problems with your uterine lining. But it is much more of a higher risk if you have twins in your uterus and you already have problems conceiving. So that is about Clomid versus Letrozole. Now I'm on Letrozole, and the only effects I've had on my body was it makes you very, very moody. That's all. I was very cranky when I first started taking it, and I've had a little bit of a migraine. My bones were hurting a little bit because it affects your bones. Now with these medicines, you want to take some calcium, and always make sure your bones are safe, because medicines like these, they do cause osteoporosis. So you want to make sure you're eating healthy, you're taking your vitamins, taking your prenatals, and just be aware if you are having too much bone pain that you do need to contact your doctor, and maybe this isn't the medicine for you. Okay, so I wanted to go over IVF. Now, in my research, I was going over some IVF stuff, and you know, you gotta weigh the pros and the cons about having assistance getting pregnant. Now, a lot of people are for IVF, and that's good. If you're for IVF, you know, just make sure you do your research on the risk factors of IVF. IVF has helped many, many parents get pregnant and have healthy babies, but there are risks associated with it, and I know sometimes that the doctors don't go over all the risks with you. So what it is there's different steps to IVF. Okay. They stimulate, which is the Letrozole or Clomid. They put you on some medicine first. They collect, and then they meet the sperm and the egg in a petri dish, and then whenever you ovulate, that's when they inseminate you. But if you overstimulate, and now if you are on Clomid or Letrozole, you know when you overstimulate, that means your hormones are too high, and it cancels out your month of trying, because you've overstimulated. There's no way that you are going to conceive because you have produced too many eggs. Now when you overstimulate, you probably produce more than 4 eggs, and that will cancel out, because then it's not safe to do it if you overstimulate. Now during the stimulation, you can get enlarged ovaries, and that's with any medicine of fertility. You have nausea and vomiting, and you can have protein containing fluid in your abdominal cavity, compromised kidney function. Now with letrozole, there is a higher chance of compromised kidney function. You can have a blood clot, and that can cause a heart attack or a stroke. And you can have an allergic reaction. Of course, you'll know whenever you are having an allergic reaction to something, because then you'll feel a little off. Okay, so the egg collection, the needle is used to collect the eggs. And of course, if you're sticking a needle anywhere, there's a possibility of it going somewhere it's not supposed to go. And it could do damage to your intestines or a major blood vessel, which the chances of that is very little. It is 1 to 10,000 or less, so that hardly ever happens. So they do your egg and your sperm meeting, and then your embryo can be placed. After that, your embryo being placed into your uterus can cause an infection. Now, whenever you're having an infection and you're trying to conceive, it can be bad because that can cause you to miscarry. But you know that the chances of that are very, very low. I just wanted to go over that with you. And now you have the 2-week wait. The chances of multiple babies with IVF are a lot higher. Okay, so let's go over. This is called the analyst something. I don't know. It's the data that they've collected over a period of time on IVF. IVF, the birth defects are 1.67 times higher than a normal conception. Now, the birth defects, they are very specific on what could happen to your baby. They could have septal defect, which is a hole in the heart. They can have cleft lip or cleft palate, narrowing of the esophagus, or anorectal narrowing. Those are some major defects, and that's the most common that they have collected over the babies of IVF. So they collect that pattern and say this is the most common defect in the IVF children. Now, women with IVF babies have a 2.5-fold chance for bleeding during pregnancy. Now, bleeding during pregnancy can increase your risk for miscarriage. You can have high blood pressure, preterm rupture of the membranes, gastrointestinal problems. You can have gestational diabetes, and it says that they are smaller. The babies come out smaller, small for gestational age. So you got to weigh your risks versus the pros and the cons of having IVF versus trying with medicines. Now it says that the risks are lower significantly if you produce your eggs, they collect it, they freeze them, and then you go one cycle, and then after that one cycle of waiting, they inject the egg into your uterus, and they said that has a higher chance of surviving, and it lowers your risk for miscarriage and birth defects as well. I just wanted to go over the risks. I know it's very scary whenever you try to start conceiving, and hopefully you don't ever have to take any kind of medication or anything like that to get you pregnant. But if you do, you can always ask me questions, or I know ladies that are out there that you can ask questions with as well. I just want to keep you guys as informed as possible with your fertility journey. Now, I know that there's technology out there that will help you get pregnant as well. Now, I just wanted to go over that with you. A lot of that technology will say that it is not compatible with polycystic ovary syndrome or endometriosis, because it's a kind of like a period predictor. And if anyone that has an irregular period knows that those apps and everything like that, it's never right on whenever you are to expect your period or your ovulation. Now, the best way, in my opinion, to predict your ovulation is through the ovulation test strips. And now we do have those in our A Mother's Prayer box for your conception help. Now, and those are little test strips you can tape to a page so you know if you're ovulating or not, and you guys can send me whatever questions that you guys have. I'm trying to answer everybody's questions. So if you want to inbox me with your questions, and I will try to get back with you and answer them. And we will go over IUIs next time and the medicines that you'll probably have to take for that. Thank you. Have a nice day.